Hello and welcome to our podcast series, Conversations with KidsPeace. I'm Bob Martin. If I asked you what's the biggest single barrier to providing effective mental and behavioral health care to those in need of it in America, you might say cost, or the lack of a variety of services, or geography as in access in rural areas versus urban areas, or a national shortage of qualified physicians, therapists, and care workers. All of those are good answers, but I'd argue there's a much more far-reaching issue that actually contributes to all those factors and more. It's the stigma that our society traditionally attaches to the issue of mental health, and our discussion today is about combating that stigma. To do that, we are delighted to have with us a great friend of KidsPeace. Michael Schlossberg is a blogger, a published author, a social media expert, and a speaker and advocate for greater access to mental health care based on his own life experiences. And somehow, with all that going on, he also manages to represent the 132nd District in the Pennsylvania State House of Representatives. Mike Schlossberg, welcome to the Conversations Podcast.
Thanks for having me, Bob. This is fun.
Oh, it's great to have you. And I want to start first to begin with, talk about your background. You have been tremendously candid in a public way about dealing with mental health issues, which started when you had to face your depression when you were in college. Can you describe that experience for our listeners?
Yeah. I, like many people who have suffered from depression or anxiety, grew up as a kid that was a little tightly wound and too emotional, so to speak. It always, I guess it's easy to say in retrospect, but it always kind of felt like there was something a little bit wrong. For me, and like many people who suffer from depression, my mental health issues really exploded when I got to college, first few weeks of college. I was unmoored from everything I'd ever known, my family, my friends, my home, all gone, and was overwhelmed by the experience and just completely, I could not get myself into a groove at college. I got very, very depressed. And more so than just, oh, I'm sad, or, oh, this is hard, like, oh, I don't want to get out of bed. I don't want to go to class. I just want to sit down and cry.
I think that's a really important point that people don't understand. A lot of folks who are not familiar with this, that you say depression, they're like, oh, I have bad days, I'm blue, and everything. It's not that at all.
Depression is when you lose the ability to function. And that depression is also much more than sadness. It can involve emotional numbness, anxiety, complete loss of appetite, loss of sleep, loss of tasks that you used to be able to do with no problem. It gets clinical in my mind when you lose the ability to function. That's when you cross the line from being down to, wow, everything is terrible. And it's over an extended period of time, at least 2 weeks, clinically speaking. And that was definitely the case for me when I first got to school. And from there, was lucky, was able to use Muhlenberg's I was a Muhlenberg College alumni, used Muhlenberg's counseling center. That helped, but not enough. I went on medication and have been on that all my life.
Now, when you realized there was something wrong, mm-hmm. and that you made this effort, but did you feel held back or restrained in your own mind?
No, with a but. The but is that Muhlenberg, to its credit, and its first year seminars, the school really went out of its way to say the counseling center is here if you need it, and don't be ashamed. They really made an active effort to sort of fight down that stigma that keeps you out of it. And I remember thinking at the time, I wonder why I never thought about seeing a therapist at home. And in retrospect, probably because I was too afraid of what that would mean, that it would mean that there was something wrong. And of course there was something wrong, but that's not a bad thing.
Well, but you would have to talk to your family, talk to your friends, talk to your school folks and everything. And like you said, in almost a perverse way, it may have been better to not have those connections in place.
Absolutely.
To get you to where you needed to be.
Absolutely. And especially, from a family perspective, I wasn't worried, but I think it was more of the self-stigma. I think at the time, before I got to school, I was more, this will mean I'm crazy. Well, yeah, but that's okay, and crazy's not a bad thing. We're all nuts. You just be smart enough to deal with it. And that's kind of that's the point that I hit at school, and I'm glad that I did that. And, so for me, I've been on medication all my life, in and out of therapy on an as-needed basis, but I feel like the form of depression, not so much with the anxiety, but the form of depression that I have is chronic and in some form or fashion probably going to be with me all my life. Combination of genetics and life circumstances, that's the way it is. And I feel like as long as you manage that, there's nothing to be embarrassed about or ashamed about. And I came to the conclusion that that's a conversation that that we need to have, that I need to use to have.
And I think you said something really interesting there, which was self-stigma, mm-hmm. that sometimes the enemy is the one between your ears.
Yep.
Like you can't get to that
in so many
point.
ways, but yes.
But you made, and I don't want to embarrass you by saying this, but you made what I consider to be an extraordinary jump. You went from dealing with this, living with this, as a person with depression within your own life, to writing and blogging about the issue publicly. Why did you decide to do that?
Because it had to happen. And the actual impetus, the snap decision, because that's kind of what it was Robin Williams' suicide. And specifically, I always talk about this, specifically a Facebook status. So Robin Williams killed himself. And like many people with depression, I really took that one hard, because you think if a guy is funny with all the money that he had everything he could want.
Absolute success,
right? All the money in the world. If he killed himself, what's to say it's not going to be me one day? So I was putzing through Facebook that day, and everyone's Facebook status was so sad, Robin Williams. And there was some idiot that I was friends with, couldn't tell you who he was because I hit the defriend button on the spot, but had something to the effect of, so sad Robin Williams killed himself. He just needed more faith in Jesus. And I was like, you're an idiot. That's not how this works at all. This isn't faith. You can't pray depression away. You can't pray away a chronic illness. Ironically, prayer and religion can help, but you can't expect something as severe as depression to disappear. And I was pissed off, and I fired out an angry Facebook status, and I went to bed thinking about it. And I remember turning to my wife that night and saying, maybe I need to say something publicly. She said, maybe you do. I woke up the next day, and I'm still pissed off. And at 5 a.m, wrote this op-ed where I came out, so to speak, with my own depression, talking about what depression is, how it affects people, and how nobody should be embarrassed or ashamed about it. And sent it to my staff. They massaged my angry words into something a little bit more coherent.
Your brilliant prose at 5 o'clock in the morning.
It basically worked, but they were like, all right, let's just tweak this a little bit. Sent it to the morning call. They called me a couple hours later, like, we love it. We're going to publish it later today. It'll be in the paper tomorrow. It's like, great. That's really great. I'm going to panic now, because it hadn't quite. And then I was so filled with righteous anger. I was like, this is going to be great. And then when the reality hit, I went, oh God, what did I do? So I called my friends, were like, calm down. No, you got this. This is good. This is very good. And my best friend, Peter Schweier, who now serves with me in the legislature, said, this is going to change your career in a way that you didn't quite anticipate. I said, how do you mean? He said, you're about to become a mental health guy. And he was right. And the op-ed was greeted. I underestimated how much people wanted to hear somebody say that. And not me, because I wasn't the only one, even locally at the time, that said that. He had Express Times editors, small business owners come out and say me too. And all of that has had the effect of combating stigma and making depression more personable. Because if you could see people who seem happy from the outside but still feel that pain internally, you can know that if it's you, it's okay. You can still function and be successful and talk about it.
And really, you're taking down the level of mysteriousness that goes to it. To your point about when you hear, in the past year, we've seen very successful folks sadly die as a result of suicide. Anthony Bourdain, Kate Spade. And you say, people always do say that. How could they be that unhappy? And when you say, this is the process, this is what people are going through, these are some of the causes, all those things. It basically, in some ways, stigma and mystery come at the same frequency kind of thing.
And we have to humanize depression. We know that 1 in 5 Americans actively suffer from some sort of depression, but only 30 to 40% are going to seek treatment. You listed a million of the reasons why, but stigma is a huge part of it. And stigma especially hits people who don't know better about depression, or unfortunately people who culturally are more attuned to say, I can get rid of this on my own. And that's a lot of times that's men, and a lot of times that's minority communities. And together we need to be better about how we talk about depression.
In your opinion, from where you stand, what's the biggest source of the negative stigma around mental health treatment?
I think we've internalized, I'll go back to what I just said about men in particular, actually. We've internalized it to mean I'm weak or I'm broken. We think that if we're sad for no reason, there must be something wrong with us, and man up, tough it out, be a man. No, that's stupid. You don't man your way through a broken leg. You can't man your way through depression.
Yeah, I mean, take out mental health, put in the word diabetes, put in the word pediatric cancer. You would never say, just tough it out. You'll be better tomorrow. Get up and do something.
And that's when I have the conversation. So fun part of my job is I talk with kids a lot. And when I have the conversation about who I am and what I do, I always bring this up. I go out of my way. And the exact example that I use when I'm talking with 5th graders is, okay, so if you're skateboarding and you break your arm, what do you do? And they're like, well, you call 911, go to a doctor, get help. Like, right. there you go. And then I kind of transitioned to mental health from there.
Well, that's, kids are way more smarter than us
There's
adults.
no question.
That's a great intro to something I want to talk about now. We mentioned in your intro that you are a published author. Mm-hmm. Tell us about your latest venture, the young adult novel Redemption. What's going on?
I wrote a book called Redemption, and it is on the surface, it sounds like a kind of sci-fi dystopian book. It's about 20 kids who wake up on board a spaceship and have to save the world. The hook of it, and the part that makes it different, the mental health hook, is that the main character, who's the captain of the ship, suffers from depression and anxiety issues. And the book, I think, is interesting regardless of that aspect, but it's particularly interesting there because the purpose of the book is to try to demystify and explain what depression is, what an anxiety attack feels like, what it feels like to be so hopeless you can't get out of bed despite the responsibilities in front of you. I mean, there is also a pretty baseball bat, glaringly obvious metaphor there that depression can feel like the weight of the world is on your shoulders, and in the case of the main character, Ash, it really is on his shoulders. But I do want to also show that you can live through depression, that if you tackle it, you can be successful, and that you can do anything, including maybe save the world.
Does fiction give you some opportunity to do that better than blogging or nonfiction?
Yeah, definitely better than nonfiction because it's a good hook. I think somebody reading this, whether or not they know what depression and anxiety is like or not, can read it and get a better understanding, and also can kind of destigmatize it a little bit. One of the nicest compliment I get about the book is when someone who knows what it's like says to me, "Oh man, you described that anxiety attack perfectly." It's like, all right, good. So that means that somebody who doesn't know what it's like can get a better idea of what anxiety is and how you can be helpful maybe to somebody who does suffer.
And that's what you're looking to try to get out of obviously you're an author, you'd like people to feel like they're entertained, It's been a good read.
Oh yeah.
But what you want them to walk away from is that understanding and that insight.
I want the issue destigmatized a little bit, and that's why I think and I hope the book has some level of importance. I want people to know what it's like, and I want them to understand they can live and be happy with it.
If there were one thing that you feel that we could do in any field, the most effective thing we could do to combat stigma of mental health treatment, what would that be? Normal people have to put a public face on it. Me talking about it, any celebrity talking about it, and I use myself as a celebrity in not the I'm so important sense, but in that I have some public renown, so to speak, infamy, as a legislator. That's good and it's important, but people have a harder time relating to celebrities. Normal people have to, in everyday conversations, talk about their own experiences with mental illness, depression, anxiety, addiction, whatever. The most important way we can destigmatize the issue is by having a normal human being talk about mental illness the same way they would talk about a physical ailment. That is how you make it truly relatable, and that's how you destigmatize the issue. Are there any public policy initiatives you're looking at? Again, to remind folks, you are a member of the Pennsylvania State House of Representatives and obviously been very active in this. Is there anything that you see either there or in the general governmental realm that is trying to attack this issue? From a stigma perspective, that government can help with funding and creating programs, but that's got to come from some of the advocacy groups, things like NAMI and the American Foundation for Suicide Prevention. This year, if we're talking about mental health, what I'm looking to really tackle is mental health parity, as well as trying to come up with programs and mentorships for first responders. We know that there are vulnerable communities more likely to suffer from mental illness and suicide, first responders being really high up there among them. So I'm working with some Republicans right now to try to develop legislation that would make it easier for first responders to get the help that they need, create mentorship programs, hotlines that they could call, again, destigmatize the issue. We were just talking about, that kind of macho attitude, and my God, do first responders have it. Well, and they'll be the first to admit it. We actually have done couple podcasts talking about this issue. Yep. And one of the things you get from there, and I thought it was really interesting how you said that about the character in your book feeling that the weight of the world is on your shoulder. I'm sure folks that are in that situation, and certainly the first responders, are always saying, I'm okay, take care of them. Yeah, I'm okay. Absolutely. My men need your help, or whatever it is. Yep. And we're trying to get to the point of going, yeah, we're not ready to accept that you're okay. We need to look at this. And the good news there is there's an increased recognition that they need to deal with it. And they know that, but we in government have to help give them the tools they need so they can do that. Well, we ask each of our guests to end their interviews on a life hack. Yep. This can be a piece of advice, a tip on how to do something around the house better that you found and everything. So, Mike, what's your life hack
My
today?
life hack is especially for people who are depressed and have a hard time getting out of bed. And the answer is do something little. Do something little that will just get you going. It might be as simple as going to the bathroom and brushing your teeth. It might be making your bed, or it might be doing some sort of activity that is completely engaging, like going to the gym. To anybody who is depressed, the best thing I could say is just do one little thing and see where that takes you. Related to that, I yesterday spent about 4 hours baking a cake. It was terrible, but it's the first time I've ever tried to bake. Not terrible, it just wasn't as good as I wanted it to be. But man,
it was terrible to the last bite, is what you're saying.
Yes, no, it was big. It was red velvet cake, and the cake was good. I messed up the frosting 6 ways from Sunday, but that's fine. Just do something that will completely gain your attention. If you can't do that, do something little and go from there.
Awesome. Michael Schlossberg is a blogger, author, mental health advocate, and a member of the Pennsylvania State House of Representatives. Mike, thank you for coming and joining us.
Thank you for having me, Bob.
We would love to have you come back sometime.
Anytime.
All right. Thank you for joining us. We look forward to having you join us again for more conversations with KidsPeace. Take care.